Merriam-Webster dictionary defines healthcare as the efforts made to maintain or restore physical, mental, or emotional well-being, especially by trained and licensed professionals. There are two types of healthcare, one being universal healthcare and the other one being a more traditional healthcare. Apart from both types, healthcare has been developing since the 1850s, and since then it has gone to the state it is in today because of innovations in the medical field and ingenious governments.
Currently, healthcare is on the rise, growing alongside globalization and helping more people each time.
Healthcare comes in many ways, shapes and forms. The popular way that most first world countries use is universal healthcare. This is a free medical care that has medical costs for all the citizens in the country has paid. Some nations who do not use universal health insurance resort to another type of healthcare, which involves buying the insurance from companies who offer health coverage. Other nations use both systems, in which the citizens decide, and some nations are in the transition of switching to universal healthcare. For example, there will be Mexico, South Africa, United Arab Emirates, and many others. Healthcare has not been around for such a long time, but it's a topic that requires time and small improvement in order to be perfected. These small improvements are the reason that healthcare is where it is today.
Since the start of the 1850s to the 1960s, healthcare has been growing a lot. New implementations to improve healthcare quality have resonated more and more throughout the years. These implementations include innovation on healthcare financing, sterilization, pharmaceutical, and more advancements in the medical field.
An example of these improvements would be Germany in the 1800s. Otto von Bismarck designed a state-run medical health insurance plan which helped all of its citizens. This is why he is considered the father of medical healthcare.
Globalization has helped quite a lot with improving healthcare. This is true since globalization manages to improve the income of the citizens, which leads to the country's GDP rising, which finally makes the country spend more on healthcare.
Mexico has a mixture of systems from private insurance and universal health insurance, but there's also an employee-funded scheme where they receive their insurance from the companies they work in. The biggest discussion on Mexican coverage is how relatively unequal it truly is. Many people can only afford basic healthcare, and despite the fact that the Mexican government is implementing a lot of money on healthcare, Mexico still has one of the lowest per capita output out of all that OECD, which is the Organization for Economic Cooperation and Development, barely outspending Turkey and Estonia. Back in 2004, the program Popular Health Insurance was implemented, and thanks to this achievement to a higher goal, 50 million people have benefited from the insurance. Still, there's much to do. The opinions of these programs are divided, some praising it and others wanting the government to go much further to make Mexico a fully integrated and quality-based system and replicate other Western first world and third world nations.
To contradict the common argument saying that cheaper or free healthcare equals to slower care, thanks to the study from the Commonwealth Fund, an organization that studies industrialized healthcare systems around the world, we found out that firstly, the American healthcare is really expensive compared to other Western countries. The next, and probably more important thing they found, is that Americans, they don't actually get the best healthcare system for the price that they pay. The study showed that countries that spend way less money also get appointments the same day or the next day.
In the USA, the most powerful country, the number one reason people get financially ruined is because of medical bills. According to Snopes.com, around 600,000 citizens filed for bankruptcy back in 2013.
We believe that the best health option would be universal healthcare, or also named as universal coverage. Most of the first world developed countries use this method, and also third world countries who started to transition and accommodating their citizens to this new system. With universal healthcare, citizens don't need to worry about their medical bill. Healthcare should be a right, not a privilege.